Good morning. Honorable Minister of Public Service and Labor, heads of different institutions, being public and private here present, permanent secretaries from different ministries, distinguished guests, and all protocols observed. So I'm very honored to be here also to share with you those main non-communicable risk factors that we do have in Rwanda that are killing our people, that are making really our people sick. And also, my colleague will also talk more about how this awareness program is coming really to address all those issues that we are seeing on a daily basis, and mainly what are those key issues that we have in our working environment. Next presentation. And again, among all of the deaths that we are seeing, just 77% are coming from our low and middle income countries. When we speak about NCDs, we mainly focus on, of course, NCDs, there are many, many conditions. But here we are mainly focusing on these four major NCDs, cardiovascular diseases, that are killing almost 18 million people every year. And also cancers. Cancers, really, the mortality due to cancer disease is also going up, where every year we're having 9.3 people dying every year due to cancer diseases. But also, we have also chronic respiratory diseases that also are killing 4.1 million people every year. And then the diabetes, killing 2 million people every year. And if you look at those four major NCDs, they are accounting for 80% of all those deaths due to non-communicable diseases. And if you really don't do something really to halt this increase, to stop this increase, putting in place prevention measures, doing early detection, the figures will continue to go up, and we really have major issues, consequences to the lives of our people, but also to economies of our countries. Next. So I think NCDs, they are lifestyle-related diseases. But of course, there are those modifiable risk factors that we can do something to prevent and to stop. But also there are some few NCDs that are related to genetics, but also our age. Also, it's also one of the risk factors. As we become old, also the risk of having all these NCDs is also increased. But this, if you look at physical inactivity, alcohol abuse, excessive alcohol consumption, unhealthy diet, and also tobacco, smoking, these are the root causes of these major NCDs that we are really talking about. And if you look at really every year, tobacco is really one of the main risk factors that we can even completely eliminate, but it's killing 8 million people every year. If you look at unhealthy diet, what we are eating, so we are eating junk food, we are not really eating well as it should be. So 4.1 million people are dying from unhealthy diet, and mainly excessive salt consumption. So we are having people that even add salt to their food before even tasting the food to know that the salt is enough. So just adding, because it's somehow becoming part of our habits. It's killing really many people. But also there is also another silent killer: hypertension, high blood pressure. Actually, high blood pressure itself is not a disease; it's a risk factor. And if you look at really those people dying every year, 19% are dying from high blood pressure, because this is it's a silent killer. And it's diagnosed most of the time when it has also caused some complications to different organs in our organism. But also, we cannot forget occupational risks and the living environment, killing around 23% of people dying every year. So actually, you can see that really these are things that we can really modify, that we can change, that we can even control. But even those ones that we cannot control, like age, like genetic predispositions, we can at least do early detection and be able to detect the disease at early stage, and be able to to initiate the treatment on time. Next. So where are we in Rwanda now? So we finished a study on looking at the magnitude of different NCD risk factors in the country. So it's called the STEP survey. It's a study that was conducted on 6,000 people countrywide. So these are people aged between 18 and 69 years old. So if you look at tobacco smoking, I think we can say that we are doing well, even if really we still have a long way to go. Because now the prevalence of tobacco smoking is 7.1%. This is down from 12.9% 8 years back. So, and I think some measures that are really working, we are no longer seeing tobacco advertisement, and these are things that are really working, but also some other measures that have been put in place, like increasing taxes. So, but again, our wish is to have really zero tobacco smoking. So we need also to, to decrease up to zero. If you go to alcohol drinking, so current drinkers, it's like half of our people drink alcohol. Yes. This is you can say that, okay, we always drink and it's not really an issue, but it has also increased from 41% in 2012. So as half of people are drinking, but if you analyze by sex, 6% of men drink. But the main issue is on heavy drinking. When you talk about heavy drinking, we're talking about those people drinking 6 or more bottles of beer. If you take a beer like Heineken, like Amstel, 6 bottles on a single occasion. This is really toxic. This is what we call heavy drinking. And we can also say that, yes, there has been an improvement, because now the prevalence, of the percentage of people that are engaged in heavy drinking is 15%, and it has reduced from 23% back in 2012. But again, this is really those things that are killing our river, that are predisposing us to, to different cancers. And the other issue that really you have to address is healthy eating. So if you look at the data we have now, normally WHO recommends to eat at least 5 servings of fruits or vegetables per day. Meaning that if you take like your hand, it's like a fruit that can fill your hand. Just you have to eat 5 servings, 5 hands of fruits every day. The same for vegetables. It's like 5 bananas or 5 apples every day. But if you see where we are now, so only 10% are eating the recommended amount of fruits or vegetables per day. We can also see that there has been some more improvement, but still it's really far from being where we should be. And again, if you look at the average salt consumption, we are on average eating 8 grams of salt every day, whereas the WHO is recommending to eating less than 5 grams a day. So this is also an issue that we need to address, to eat healthy and also to reduce the salt consumption. If you look at the physical activity, we are relatively doing well, because data is showing us that at least 95% of our people are doing the recommended level of physical activity. This is like, normally it's recommended to do 150 minutes per week or 30 minutes every day of moderate physical activity. But if you analyze and if you go deeper, you will find that this physical activity is mainly work-related. But if you look at those really leisure or sports that people should be doing, especially in Kigali, but also like people like civil servants or people employed by private institutions, it's not really good. I will show it on my next slides. So this is mainly people like just like doing it like as part of the transportation or as part of the work, like farmers. So it's also considered as really a physical activity. As we have seen, it's very rare to see someone who is always farming, who is always engaged in transportation, really, being obese or overweight. So, and again, obesity or overweight is also increasing in our people, and also mainly in the people working in the offices. This is also something that we need to address. From the data we have, 18% of Rwandans have got a body mass index above 25%, meaning that they are overweight. So this has also increased from 17% in 2012. But also obesity, we can say that people who have got body mass index above 30, we are now at 4.3%, but also there has also been an increase from 2.8 in 2012. So we need also to really stop this, because these are things that we can do by doing physical activity, but also eating healthy, but also managing, our stress. If you go to high blood pressure, hypertension, the prevalence of people with high blood pressure, we are now at 16.8%. There has been really an increase compared to the data from 2012. And if you look at diabetes, the prevalence of diabetes now is around 3%. You can say that this one has really stabilized. And people have been really doing screening in this tent. And if you allow us, we can also show, you the data you have from people that have been undergoing the screening. Next. So just from our STEP survey, we also tried to look at some risk factors that are related to what we do to our occupations, to our work. So we've seen that still people are still smoking in working environment. And again, these are things that really have to be addressed in the workplace awareness program, as 30% of people are exposed to second-hand smoke in a working environment. So, and if you look at also, yes, this is what I was saying. So, yes, overweight at the national level, we are at 18.6%, but we have a high prevalence of overweight in civil servants, in people working for the government. But also, if you look at people working for non-government institutions, 18%, and the people who are self-employed, the overweight is 19.7%, meaning that really we are concerned. It's really a concern that really we have to address by doing physical activities, irregular physical activities, but also trying to eat healthy. If you look at people doing sports, because most of our institutions have got, partnerships with different gyms, but only 34% of government employees are doing, are engaged in sports on a regular basis. This is also another issue that we have to address, but also to enforce or to make sure that really people are doing it. Versus 25% in non-government employees and also 21% in self-employed. The other big issue, but we can see that it's not really bad. So like 83% of government employees have ever had their blood pressure measured. So again, at least it was a question asking, have you even once have really your blood pressure measured? We have seen that only 83%. And then we have really our insurances are covering regular checkup, but we are not really using it. But these are things that I think this program is coming to address. But the checkup, the blood pressure measurement goes down in non-government employees, but also in people who are self-employed. But again, at overall, we are at 55%. These are people that at least are measuring their blood pressure on a regular basis to see how it is. If you go to glucose, diabetes screening, really the numbers are low. It's only 33% of our people or of our employees are doing, blood glucose screening on a regular basis, at least once a year. This is also something that we can also really improve. And really the percentages go down if you go in non-government employees, but also in people who are self-employed. So again, these are things that really we have really to make sure that we change our habits, we change really the way we are living. Because if you take an example, many people here have come here using their own cars. And their own cars, every year you go for technical inspection by the police. But we don't remember also to do the technical check or inspection for our own body. So these are really things that really have to change and make sure that really we love ourselves even more than we are loving our cars. Because maybe the police is there, enforcing it. But again, this should not really, this should really be part of our, our culture, our habits. Next. Yes, mental health disorders is also an issue. these are data from the mental health survey from 2018. So, and of course, these are the national data. I mean, the message is that 1 in 5 people has got mental health disorder. Any mental health disorder, and these also include, employees, civil servants, but also people working for private institutions. And again, this is really to show that this is also another issue. And sometimes work-related stress also is also worsening this situation. So how can we bring in our working environment counseling, programs, counseling initiatives, teaching people how to manage work-related stress, but also be able to consult on time. So this is also another issue that has also to be addressed by this wellness program. Next. So actually, and I think many people here might agree with me, we do care about the work more than we care about ourselves. So sometimes we are really working overtime, prioritizing, finishing our tasks, and really this is, I think it's killing many people. So many people even skip the lunch just because they have really urgent tasks to complete. And sometimes we are eating processed food or fast food because we don't have time even to take that 1 hour break to go maybe in a restaurant and try to find healthy food. So they are bringing sandwich for us, they are bringing, pizzas in our offices. So these are things that really are contributing to all of these issues. We don't even have time to exercise, to go in those, gyms where you have subscriptions. So again, this is also another issue that we have to address in this wellness program. Many people even forget to take their annual leave, their annual leave, because there are still a lot of urgent tasks to accomplish, and these are things that are really, increasing. They are also NCD risk factors. And again, these are things that we wish really to be those outstanding employees, or really contributing a lot to our institutions. But we should also make sure that we should be healthy to be able to continuously or to do it for a long time. That's why we should also make sure that we are caring for ourselves. So, and actually, we think that health employees bring a range of benefits to the institutions they work for. So, and I think all employees here would wish to have health, active employees, not really those people always just being in sick leave, have got always back pain and so on. So, and then some of those issues are really caused by the working environment. Next. So, and as I conclude my presentation, it was just to show you how really those issues are. And I think really this workplace wellness program is really coming as a solution, mainly tackling non-communicable disease at the workplace, because most of people here spend, much of their time at their workplace. If you can bring NCD's prevention, teaching people about NCD risk factors, but also to offer NCD early detection or screening services at that same workplace, and I think it can help us to address the issue of non-communicable diseases, because most of them, they are diagnosed with complications, and yet it was a process that has been there for maybe 5 years or even more. So having really these services at workplace can help us, and this can be done using OSH committees that should be available in different institutions. And again, we should have really programs or initiatives or capacitate our employees on how to manage, to prevent and manage work-related stress and also mental health disorders. So because these are really the real issues, these are that we have in our working environment, but also be able to prevent and control occupational and work-related hazards. So, and we think that these will be the main components, the main interventions that we will have in our wellness program at workplace. But my colleague Patrick will really shed more light, give us more details on how this program will work and what we are really benefiting from it. So, thank you so much for your kind attention. These are the few slides that we prepared for you, just to show you how these non-communicable diseases, mental health disorders, are a huge issue into our working environment. Thank you so much for your kind attention.